My presentation has to do with parental influence on childhood obesity. The PICO question that began the research that I did was, are children aged 3 to 17 with obese parents more at risk for obesity than children without obese parents? As we can see, increased obesity rates have come about definitely since the 1980s. We see that children obesity rates have increased from 7% to 18%. In adolescents, it's increased 5% to 21% over the period of 1980 to 2012. Also, we note that in 2012, more than 1/3 of children and adolescents are considered overweight or obese. There are several health effects that it will be important to address in patients, and these include immediate and long-term effects. Some immediate health effects of obesity include high cholesterol and blood pressure, prediabetes, bone and joint problems, sleep apnea, and long-term health effects include heart disease, osteoarthritis, stroke, diabetes type 2, and several types of cancers. It is the nurse practitioner's responsibility to decrease the incidence of obesity, understand the risks involved with obesity, understand the best treatment options to optimize patient health, and educate families about risk factors for obesity. Studies included in my integrative review included a qualitative study where researchers interviewed participants of overweight and non-overweight children. The findings showed that mothers with overweight children had less energy than those with non-overweight children to act on measures to control their children's weight management, which is important to note. The second review was a quantitative stratified random sample about identifying factors associated with parental concern about weight. We found here that concerned parents were more likely to do 3 things, which were limit screen time, increase physical activity, and improve diet, more so than non-concerned parents. So it's important as nurse practitioners to make parents aware of the problems that could come about from obesity and make them concerned. Another study was a quantitative study where researchers examined which factors predict unsuccessful outcomes in weight management of obese children. This research was done in the United Kingdom through a weight loss program, and they found there are several things that predict unsuccessful outcomes, but the most important one was families who had both parents obese, and these parents made it 6 times more likely for these children to be unsuccessful in weight loss versus the families that did not. The fourth quantitative study was a parent-child resemblance in weight status in the United States. Basically, here it just showed how much more likely children were to be obese if their father or mother or both were obese. And we see here that 3.2 times more likely to have both obese parents, but if one, then they would be more likely than them to not have an obese parent. The fifth study had to do with a virtual buffet with an overweight mother's food choices. And here we found that mothers' calorie choices for their child were higher when a mother and father were obese, even though the father was not present. But food choices were highest then, and they were more restrictive when only one parent was obese, or the mother. These are all important findings, and we find that it is important to do several things in regards to these studies. These include empower mothers to become involved in children's weight management, create concern in parents through education so that they can make choices that will help and optimize their children. 3 is help families create weight loss management and success in homes by tailoring plans to them. 4 is give patients research about rates of childhood obesity based on parenthood obesity. And 5 is guide families in limiting food intake and helping them understand the importance of family history and diseases linked to obesity. An intervention that could happen in a family practice office could be a pamphlet or a slideshow that includes for families to view risk of obesity associated with having overweight parents, and comorbidities linked to obesity. Also noted that NPs should be part of research that analyze the effectiveness of certain interventions to improve future practice.